Good morning. After 10 months of living with coronavirus, Lewis County is excited to announce a new phase of pandemic response. Starting tomorrow, Lewis County Public Health will begin distributing vaccines to Group 1A and Group 1B. The county staff will provide additional details on eligibility and distribution logistics. The vaccine has the potential to be the silver bullet, the one weapon that has the ability to restore a sense of normalcy to our lives. Dr. Harney will provide some key information this morning about vaccine effectiveness and safety. We encourage each individual to take the time to properly research the vaccine and make the right decision for you and for your community. On behalf of the Board of Legislators, I'd like to thank county staff, particularly Public Health Department, for their continued dedication to public safety. To those community members who do continue to do the right thing to protect themselves and their neighbors, hang in there. Your effort and sacrifice is truly saving lives in our community. With that, I'll turn it over to Ryan and the county staff for additional details on our plans this week. Ryan?
Thank you, Larry. As always, you'll note that our staff here and everyone in the building is wearing their masks. We are 6 feet apart, but for the purpose of communicating with the public, we'll take our masks off when we're speaking. As Larry noted, New York State has now entered phase 1B of vaccine distribution. We're going to run through the list here of everyone who's eligible for 1B. It's quite a list. And then we're going to talk specifically about how Lewis County will be administering vaccines this week. So I'm going to read phase 1A and phase 1B because folks that are in phase 1A are still eligible. In fact, they're the most at risk, so that we would encourage them to take the time to come get vaccinated. Phase 1A eligibility is high-risk hospital workers, residents and staff at nursing homes and other congregate care facilities, federally qualified health center employees, EMS workers, coroners, medical examiners, and certain funeral workers, staff and residents at OPWDD, OMH, and OASIS facilities, urgent care providers, individuals administering COVID-19 vaccines, including local health departments, all outpatient, ambulatory, frontline, high-risk healthcare workers of any age who provide direct in-person patient care, all staff who are in direct contact with patients, all frontline, high-risk public health workers who have direct contact with patients, staff of nursing homes, skilled nursing facilities who do not receive COVID vaccinations through primary partnerships for long-term care program. That's phase 1A. New today, starting today, is phase 1B. This is who's eligible for phase 1B. Individuals age 75 or older. That's everybody. Anyone in the public that's over 75 is eligible. First responder and support staff for first responder agencies. This includes fire services, including state fire service volunteers and fire investigators, local fire service, including firefighters, investigators, both paid and volunteer. Police and police investigations, including state police, state park police, DEC police, forest rangers, SUNY police, sheriff's offices, county police departments and police districts, city, town, and village police departments, transit of other public authority police departments. Public safety communications personnel are also eligible. That means emergency communication and public safety answering folks, meaning folks that work in the dispatch. Other sworn and civilian personnel, including court officers, other police or peace officers, and support or civilian staff of any of the above service or agencies. Folks that work in corrections are eligible. State Department of Corrections and Community Supervision personnel, including correction and parole officers. Local correctional facilities, including correction officers. Local probation departments, including probation officers. State juvenile detention and rehabilitation facilities, and local juvenile detention and rehabilitation facilities. School personnel are also eligible. This is going to be a big portion of the vaccines in Lewis County. K through preschool through 12 school providers are eligible, and it's anyone that is district faculty or staff, including teachers, substitute teachers, student teachers, school administrators, paraprofessional staff, and support staff, including bus drivers. Also eligible under schools are contractors working in a preschool through 12 school or school district. Also qualified under child care and school: licensed, registered, approved, or legally exempt child care providers. Also eligible, employees or support staff of any child care setting. Public transit employees. In Lewis County, that's just going to apply to public bus drivers. And lastly, individuals living in a homeless shelter where sleeping, bathing, or eating accommodations must be shared with individuals and families who are not part of your household. The last category is public-facing grocery store workers and in-person college instructors. So that's a big group. This is on our website. It will be on our website as of noon today. It's on the state's website, so this will be written. We'll also put out a press release with all this information, so everyone will have it in writing. You don't have to rely on watching this entire video. So that's who's eligible. How are we going to get them the vaccine? We will have 3 clinics this week. First will be Tuesday the 12th at the Lowville Elks Club from 1:30 to 5:30 p.m. Wednesday the 13th will be at the Constableville Fire Hall from 1:30 to 5:30 p.m. Thursday the 14th will be at the Krogan Fire Hall from 1:30 to 5:30 p.m. Registration for these clinics will be open at noon today. Registration is open online at lewiscounty.org. Right on the home screen, there's going to be a big banner. Click here for vaccine registration. For those without internet, we have a phone number set up, 315-376-9777. That's 315-376-9777. This line is staffed by Lewis County employees. If you call the number, someone here at the county will answer, and we will enroll you in your clinic time over the phone. Please, if you have internet access, do not use the phone number. The internet may be slow. There's going to be a lot of people trying to enroll. Please save the phone number for folks that don't have internet access. And really, we want to save the phone number for people that are 75 and older. You know, those are the folks that are going to struggle a little bit with the technology. If they can just call the phone number, have somebody from Office for the Aging or one of our other great county employees enroll them in their time, that's going to be much easier. So please, if you have internet access, hang in there, use the online link, do not inundate the phone lines. Save that for folks that do not have internet access or who are elderly. Additionally, do not call public health. Do not call county public health and expect to get a time. Use the number that we are going to make public. It'll be on the website as well, but the number is 376-9777. Don't call public health. Ashley's team is busy enough. They've got to do contact tracing, quarantine, monitoring, and now set up vaccine pods 3 days a week. So do not inundate the public health phone lines. Once you have your appointment and you get to the pod, which Ashley is going to explain how that will work, we will require proof of eligibility at the door, and we will have security folks there to enforce this. So if you are eligible in one of the phases, one of the categories that we talked about, you will have to provide proof of eligibility in order to get the vaccine. Proof of eligibility include your workplace ID. If you work for a school, you've probably got a badge. If you're law enforcement, you've probably got a badge. A pay stub. If you work for a child care provider and you got paid last week, bring in your pay stub. Professional license, right? If you're a bus driver and you need a special CDL, bring in your CDL that proves that you're a bus driver. Or if you can't get any of those things, something on your employer's letterhead that says you're eligible. If you are above the age of 75, you will just need to bring an ID with your date of birth. That's all we'll require. If you're over 75, just something that has your date of birth that shows you are eligible for the vaccine. As I said, we will have security at the door, and we really appeal to the community of Lewis County. I know everybody wants the vaccine. I know we all want to get on with our lives, but it is important that we try to follow the order here, because we know those 75 and above are most at risk. We know people that are in schools every day with students coming in and out, those folks are at risk. Police officers that are going in and out of homes and in and out of vehicles, you know, with the public, those people are at risk. So if you're not eligible in these phases, we'd ask you to please, you know, wait until your phase is eligible. The last thing I'll mention is that our supply of vaccines, which I don't want to get too much in the weeds on, but we do currently have at Public Health 500 doses of the Mrna Vaccine. That's what we'll be distributing. Doc's going to talk more about what the Mrna Vaccine does. But with that, I'm going to turn it over to Ashley. She's going to talk about the pods themselves and what you can expect once you sign up for your time slot. Ashley?
Thank you, Ryan. So I will inform everybody what they can expect when they come to one of our COVID vaccine clinics. The first thing that will happen is when you come in, we will check your eligibility. We will check for your appointment, so individuals must be pre-registered and they must have that eligibility in order to continue on with receiving the vaccine. We will be checking temperatures at the door. Everyone who comes to be vaccinated should be wearing a mask. That's the first station. The second station is everyone will receive education about the vaccine that they're about to receive. They'll have an opportunity to ask questions. They will be screened. Part of the pre-registration is answering a series of screening questions to make sure that they're eligible to receive the vaccine from a health standpoint. Based on these screening questions, we'll determine how long the individual needs to wait after they receive the vaccine. So from screening, they go to the vaccine area where they will be administered the vaccine. Again, they'll have an opportunity to ask questions specifically to the nurse. From there, they will go to the recovery area. That is an area where individuals, after receiving the vaccine, will be required to wait at least 15 minutes. Anybody who has previously had an anaphylaxis reaction will need to wait 30 minutes after receiving the vaccine. We will have this set up in a way that maintains social distancing. And we will also have an area where individuals will register for their next appointment. So 28 days after receiving the first dose, they need to receive their second dose. So we will have the clinic scheduled 28 days from then that they'll register for an appointment on that day. Everything is done on the computer system that they'll be pre-registered. We will pull up your information. It'll all be right there. We will enter the vaccine information in. That information is automatically uploaded to the statewide immunization registry. So everyone's provider will have access to that information. They'll know that their patient has been vaccinated against COVID. And just so everybody knows, this is not our first pod. We've held many pods in the past. Some of them drills with hepatitis A vaccine, some of them real life with flu vaccine. So this is something that we've drilled, we're prepared for. I will say though, this is our first COVID vaccine pod. So this week we have 3 scheduled. This is a learning week. And from there we will perfect our process and we will be continuing these pods. So I ask everybody to be patient. Your turn will come. And one thing that I do think is very important to know is if you are on isolation or quarantine, you're unable to get the vaccine during that period. So that is something that we go over with anybody that we're doing case investigations or quarantining with, but that is something that's important to know. I believe that is it, and with that I'll turn it over to Dr. Harney.
Okay, thank you, Ashley. Hello, everybody. We've had several press conferences over the past 9-10 months, as Mr. Dahlhoff referenced, and I am very thankful that this is the one that is talking about how we're actually going to get out of this pandemic. The access to a COVID vaccine is the light at the end of the tunnel. Up to this point, we've talked about flattening curves, we've talked about lots of different things, but none of them were the answer. The COVID vaccine is the answer. That's how we're going to get out of this. The concept of flattening the curve has been discussed much in the past. The weapons that we had at that point were masks, hand washing, social distancing. Now we have a tool that can decrease the number of people in the community that can get this disease without any of those. Those things will still be necessary for the community. However, this is a way that we can just take people out of the pool of susceptible individuals. Every time we immunize 500 people, that means 500 people in our population in a month's time are no longer going to be likely candidates. This vaccine is incredibly effective. In the study so far, it's between 94 and 96% effective at preventing serious illness from COVID. So this is the light at the end of the tunnel. The biggest key to this is having enough people in our community agree to vaccinate themselves so that our community can get past this. There's been a lot of activity on the internet in a negative way regarding the vaccines, and I'd like to address some of those things. There's been some concern that this vaccine was produced so much faster than vaccines have in the past. How did that happen? Was it because it was slipshod production? No, it was not. There's a very good reason that they were able to develop this vaccine so quickly. They're using a new technology by using an mRNA, that means messenger ribonucleic acid. It's the sequence that tells cells how to produce a protein. That's what mRNA is. So this mRNA vaccine technology was in the labs being tested, and they did produce mRNA vaccine at Moderna and Pfizer for the SARS type 1, the old SARS from back in the, I think it was around 2006, 2011, somewhere in there. The original SARS-CoV-1, they took that virus and made mRNA vaccine to it. So they developed the technology testing it on that virus. That technology was available in the lab, and in January of last year, when they got the genomic sequence of the SARS-CoV-2, COVID-19, they were able to adapt that same technology using the new genomic sequence. So that's a little bit of the history of the mRNA vaccine and why it was available to us so quickly. The Messenger RNA vaccine is made up of a short sequence of mRNA that is the sequence that produces, helps the cell to produce spike protein. What the spike protein is, if you've seen pictures of coronavirus in many of the advertising about COVID, they have this round sphere that has a bunch of odd-looking projections off of it. That is the spike. The cell is encircled with spikes that are made up of protein. what the mRNA sequence does is make it so that your body produces a small amount of spike protein using the mRNA that's injected. There is no conversion of that mRNA to DNA. A lot of the negative internet things are saying this is going to change the DNA in your body and forever will change your DNA sequence. That does not happen. The mRNA is worked on in the cell outside of the nucleus. It does not produce DNA, it just produces spike protein. When your body is able to then, that spike protein is produced, and then your body recognizes that and creates an immune response and allows your body to make antibodies to the spike protein. When, after several weeks after the vaccine, your body is then producing antibody to spike protein. If you get exposed to the COVID virus, your body will immediately produce antibody to the spike protein that attach to that protein and make it so that that spike cannot attach to the cells in your body. If the spike can't attach to cells in your body, then you don't get an infection. So that's a bit about how it works. In the development of this vaccine, there is some chatter on the internet about embryonic or stem cells being used in the development of this vaccine. That is not true. This vaccine was not produced with embryonic or stem cells. Next, on to the topic of safety. There have been over 2 million doses already administered in the United States of the Mrna and very similar Pfizer mRNA vaccines. And the experience so far has been really excellent. The last literature I read about this, there were very few, less than they expected, reactions from the vaccine, very few cases of anaphylaxis, which is a total body allergic reaction. The one component of the Mrna vaccine that some people do seem to have some allergic response to is polyethylene glycol. It's a substance that's used to carry the mRNA into your body. Let's see. The people that are allergic to polyethylene glycol, it's actually I believe to be a very small percentage of the population, but those people probably should not get this vaccine if they know they're allergic to that. If you want to read more about the allergy component or anaphylaxis from the shot, there's very good description of this on the CDC website. The other thing that people may want to consider is to look at the CDC website and look at the screening questions before you go for your vaccine, so you'll know what to expect for the screening questions, so there won't be any surprises. And that way, if you need to talk to a healthcare provider about anything that comes up in the screening questions, you can do that beforehand and talk to your own primary care provider. I did get the Mrna vaccine myself. I was very thankful that I was able to get it and plan to get my second dose in a couple of weeks, and will be very thankful for the opportunity to get that. I will have all of my family members receive the vaccine once it's available. That's my endorsement as far as, is this a safe vaccine? I'm going to have my wife, daughter, and sons, grandchildren, everybody who, once they're eligible, I'm going to have my family receive the vaccine. Anything else that I missed?
Oh, that's great.
I think you're good. All right, thanks, Doc. Awesome information. I mean, this is critical. It's not going to change your DNA. It was not made with stem cells. science is an amazing thing, and we're lucky to live in a modern society that has such an amazing scientific achievement. We're teaching our body how to react to the protein that makes COVID so deadly. I mean, what an amazing scientific achievement, and we're very lucky to have it here in Lewis County. So I hope everybody, like Doc said, takes the time, researches, talk to your doctor, and we really need to get enough people in Lewis County to take the vaccine so that we're all protected as a community, not just individually. Ashley's got a bit more information on the vaccines in Lewis County.
I was just going to speak to the fact that, you know, this is our first week. We have 500 doses of vaccine now. We have been informed by the state, as of right now, we can expect to receive 500 doses a week. Now that number may change going forward, but as of right now, we're expected to receive that. Also, an important thing to note is I said that we'll be registering everybody for their second dose. Those doses are in addition to our 500 allocated per week. So the second dose shipments will be automatic after you've already administered those doses.
Okay, questions?
Will the pods here in Lewis County, when you're doing registrations, will they only be for Lewis County residents? And the other question that's kind of connected to that is, how many residents do you feel you'll be able to vaccinate in each 4-hour pod?
So, like I said, well, first of all, your first question, you must live or work in Lewis County in order to be vaccinated at one of our pods. Second question is, this is our first week. We've built in 40 appointments per hour, and we'll see how the flow goes and go from there. We may be able to do more, we may need to adjust, but as of right now, 40 an hour. And the hospital's been able to do that at their clinics as well, so it's a reasonable goal.
The only other question I had, I guess, kind of revolves around the fact that currently we're looking at, like, in the county, record numbers of active cases, hospitalizations, things like that. So how does that impact public health's resources? Are they adequately staffed to be able to do clinics, contact tracing with a high number of cases? I know the legislators have recently been adding positions to the public health department. So are they adequately staffed to be able to do everything?
We're getting there. What I will first say is this. Just like Dr. Harney said, this is another weapon in our toolkit. It has the potential to be the weapon that ends the war, but it's not the only weapon. Social distancing, washing your hands, wearing a mask remains critically important, critically important. We are still seeing our numbers in Lewis County go up on a daily basis. So there are still people in this community and still elements of this community that are not wearing masks, are not social distancing, and following those simple guidelines. So the vaccine is our long-term answer, but in the short term, we still have to be very vigilant about mask wearing and social distancing. In terms of staffing, we're a big organization. We are about $54 million a year that we spend. My perspective and Larry's perspective and the whole perspective of the board is we should be able to do two very complicated things at once. We should be able to keep up with contact tracing, monitoring, and quarantining while we're also distributing vaccines through the pods. So we have added 10 additional public health positions since the beginning of the pandemic. That's greatly helpful. We also have, at this point, an additional 98 county employees that have been transitioned from their normal job in one way or another to assist with public health. So we are really flexing every bit of organizational strength we have to keep both of these balls in the air at the same time. So public health is going to have to shift a little bit of what they do. But luckily, we've been planning for this. So they've been doing the majority of the contact tracing. We've got new people on board that are doing contact tracing. That'll allow the public health nurses to move on those pod days from contact tracing and case investigation to vaccination. We also have the quarantine effort. Folks, there's over 600 people in the county that are quarantined. That means we have to call those folks, you know, a lot of times it's 100 people a day that we're calling to inform them they're in quarantine. That effort needs to be completely moved away from public health onto the rest of the county government. So we have folks from every department. I can tell you, if there's an available body that's sitting by a phone, they're chipping in and doing quarantine calls. Monitoring, if you have COVID-19 and you're currently sick, we call or text you every single day. And we're still able to do that. We have over 200 active cases right now. You're still getting a call from a Lewis County employee. That's remarkable. Most counties have turned that over to the state or turned it over to a private entity. In Lewis County, you're still getting a call from your friend and neighbor that's asking you, how are you feeling today? How are your symptoms? Our goal is to continue that. Now, if the behavior in the community doesn't change and we get up to 300, 350 active cases, I don't know how we'll possibly keep up. We won't be able to. But if we can remain vigilant, you know, we so far in Lewis County have done a good job keeping up, and that's my goal, that's Larry's goal, that's the board's goal, that we're able to keep up in-house without needing to rely on outside help. So that's where we stand.
And with the majority of the 1A, Group 1A individuals being affiliated with the hospital had a large role with public health rolling out those vaccinations for Group 1A. Will the hospital still have a role in the new round of vaccinations with 1B, with the Group 1B?
So the county government, through public health, has the 1B vaccination supply. The reason that the state went through the hospital for 1A is because most of the healthcare employees that were eligible work for the hospitals. It's difficult to say what the state is going to do next, but my anticipation is that phase 2, 3, and then general public will be kept with public health. And in terms of finishing off all the healthcare workers, they might continue to get a supply to the hospital. But you know, that is yet to be determined, I would say.
And are these pods going to be held weekly after this week, or are we going to see how these 3 days go and then kind of go from there?
Yeah, that's our plan, is to hold them weekly. And like I said, from this week we'll learn about scheduling and things like that, and make a more concrete plan for going forward.
Do you anticipate it will be the same 3 locations each week, or will the locations vary?
We will see after this week. My hope is to, all of the local fire departments throughout the county have agreed to be pod locations for us. So I would like to at least at some point touch every area of the county, but that is yet to be determined. Part of our planning this week.
We do have Watertown Times on the phone. Julie, any questions?
I do, a couple. First of all, for questions that people have, not just scheduling, what number should they be calling? Or where should they reach out?
They should
What kind of questions?
they should try to do their research themselves first. If they do have a question that cannot be answered online or by their primary care physician, then we will take general public inquiries at public health. However, the public needs to know that the public health line is ringing off the hook. We've moved 2 additional administrative support staff down to public health every day to assist with the call volume. So we prefer that people try to reach out to your primary care physician, doctor.
The frequently asked question component of the CDC and New York State DOH websites are very good and will probably answer 90 to 95% of questions that anybody would have, and also generate an idea that the majority of the rest of the questions, the people should be asking their own primary care physician, because it would be pertinent to their own medical history. So I would, just in our workings with public health, I know that their phone is ringing off the hook, so they should not be used as the hotline for all questions.
Fair enough. Also, you spoke of the people eligible under 1B, and it's primarily people employed for kind of corporate or larger, small even, but employers. And I believe that home care is involved, and many people work for agencies. They are healthcare providers that were not included in 1A until the very end. They kind of got tacked on. What about people who do private duty, who work directly for families? What kind of proof of eligibility should they bring?
Yeah, good question. I think that the governor specifically spoke on Friday about folks that use the self-directed Medicaid care option. Those folks, I believe, are eligible as well. For them, they need to bring, they do get paid through Medicaid, so some type of proof that they're a caregiver.
Or if they have a license of any
Yeah.
sort.
Yep, yeah, licensure would count as well. Ashley, anything to add to that?
Not that I can think of.
Having said that, though, there are people who private pay caregivers that come into their home. Would they be able to get the shot? They also are at risk of spreading it.
If they're an LPN or an RN, all they need is a copy of their license.
And if they're not?
Well, if you're just a friend or neighbor that helps out your an elderly, relative every once in a while, then that's a little different than being officially employed in the business,
Oh, absolutely. But there's ground in between those two pieces, being an RN or an LPN. Like, a tremendous number of home caregivers are not nurses.
Right.
Some are CNAs and registered, but many are full-time, decades of experience, hands-on caregivers.
Well, if you
Even
work,
with the
yeah,
CNAs.
if you work for U.S. Care, we've reached out directly to that business, and I believe there's one other care provider. I can't think of the name in Lewis County. U.S. Care and, Anyway,
Okay.
yeah. I'm sorry. There is gray area in some of this. It's not going to be cut and dry, but the goal is do your research. See if the state should be putting out maybe some additional clarification. But that's the information that we have at this point. So,
Great. Thank you.
yep. Okay, that's it from us. Thanks, guys. Appreciate your time.